Before you do anything else, I want you to hold up one of your hands right now and look at it carefully. Not a quick glance. A real, deliberate look. Because in the next few minutes, I am going to show you something that most people over 60 have never been told. Something that kidney specialists observe every single day in clinical practice, but rarely take the time to explain to their patients. Your fingernails have been quietly recording what your kidneys and your blood are doing. They have been doing it your entire life. And if you know exactly what to look for, they can warn you about a kidney crisis before it ever becomes a catastrophe. If you're interested in this topic, type interested in the comments and don't forget to subscribe. The goal is to hit 200,000 subscribers, and every single person who joins moves us closer. If you want my free kidney warning signs checklist, type the words kidney checklist in the comments right now and I will send you the download link personally. Completely free. Just 2 words, kidney checklist. Drop it below and let us get started. Why your nails carry this information. Your nails grow from a structure called the nail matrix, sitting just beneath the base of each nail. The cells in the matrix are in direct, constant contact with your bloodstream, nourished by the smallest blood vessels in your entire body, the capillaries running beneath your nail bed. Your kidneys are responsible for filtering waste products from the blood, regulating fluid and mineral balance, controlling blood pressure, and producing a hormone called erythropoietin that tells your bone marrow to make red blood cells. When the kidneys begin to struggle, the consequences ripple outward through the entire body, and those tiny capillaries beneath your nails are among the first places those consequences become visible. Think of your nails as a live monitor that has been quietly running every single day. After 60, this matters even more. In earlier decades, the kidneys can silently compensate for declining function for years before anything obvious appears. After 60, those reserves are thinner, warning signals begin surfacing earlier, and your nails are often where they show up first. A typical appointment cannot cover everything, and nail examination rarely makes the priority list unless something is dramatically obvious. The research exists. It simply never reaches the person sitting at home who actually needs it. That gap is exactly what this channel is here to close. Sign 1, Lindsay's nails. The first sign is called Lindsay's nails, sometimes referred to as half and half nails. This is not a term most people have encountered, but once you know it, you will look at every pair of hands differently. Lindsay's nails occur when the nail is divided into 2 clearly visible zones. The half of the nail closest to your cuticle is white or very pale. The half closest to the tip is a reddish-brown or brownish-pink color. The line dividing the 2 zones is usually sharp and clear, not blurred or gradual. This is not subtle. Once you see it, it is unmistakable. Research has found that Lindsay's nails appear in approximately 20 to 50% of patients with chronic kidney disease, and in some studies of end-stage renal disease, that figure rises even higher. They are considered one of the most specific nail signs for kidney impairment in the medical literature. The mechanism involves 2 overlapping processes happening inside the nail bed. The pale proximal zone near the cuticle reflects reduced blood flow and changes in the connective tissue beneath the nail. The darker distal zone near the tip is thought to result from deposits of urochrome and melanin, driven by elevated levels of urea and other waste products that the kidneys can no longer properly clear from the blood. Critically, the color difference does not disappear when you press on the nail. That is an important detail. If pressing the nail makes the discoloration vanish temporarily, it is more likely a different finding called Muir's lines, which will be covered in a moment. With Lindsay's nails, the 2 zones remain visible under pressure. A person who came in for an unrelated visit had nails that were sharply divided across nearly every finger, pale near the cuticle and brownish at the tips. They had mild fatigue they had been attributing to poor sleep and occasional swelling in their ankles they had dismissed as a long day on their feet. A metabolic panel revealed their kidney function had already declined significantly. They had been in early to moderate chronic kidney disease for an extended period without knowing it. Their nails opened the conversation that made early intervention possible. If you want to know the full list of kidney warning signs your doctor may never mention, type the word kidney in the comments right now and this channel will send it directly to you. Sign 2, Terry's nails. The second sign is called Terry's nails. The nail takes on an opaque whitish or very pale appearance across almost its entire surface, almost like frosted glass, with one defining feature at the very tip. A narrow strip of pink, reddish, or brownish color at the far edge of the nail, usually just a few millimeters wide. That strip at the tip is what separates Terry's nails from simply pale nails. Look for it specifically. Terry's nails have been associated in clinical research with chronic kidney disease, liver disease, heart failure, and diabetes. A change in nail bed vascularity, thought to be caused by overgrowth of connective tissue and changes in the tiny blood vessels beneath the nail, is considered the most likely mechanism. In kidney disease specifically, the whitening is believed to reflect a combination of reduced albumin levels in the blood, anemia from declining erythropoietin production, and progressive changes in the nail bed circulation driven by long-standing kidney dysfunction. Every condition linked to Terry's nails shares one characteristic. It develops slowly and silently over years before anything dramatic happens. A study published in the Journal of General Internal Medicine identified Terry's nails as a meaningful clinical marker of serious underlying systemic disease and noted that it is frequently overlooked in routine examinations. A person came in at 72 with no urgent complaints but had been more tired than usual, something they naturally attributed to getting older. During the examination, their nails were unusually pale across the full surface with a reddish strip at the tip on multiple fingers. A full kidney function panel and blood count revealed chronic kidney disease at a stage where lifestyle changes and medication could still meaningfully slow progression. Their nails opened the conversation that made early action possible. Hold your hand under good natural light right now and look at the tip of each nail carefully. If this is new information for you, type the word nails in the comments. This channel has a full guide on what to do when you spot these signs, and it will be sent to you directly. Sign 3, Muir's lines. The third sign is called Muir's lines. These are multiple horizontal white bands running across the nail, parallel to the lunula, which is the small crescent-shaped pale area at the base of your nail. Muir's lines are most commonly found on the second, third, and fourth fingers, and they often spare the thumbnail. Here is the key detail that distinguishes them from other nail changes. They do not feel raised when you run your finger across them. You can see them clearly but cannot feel them. And when you press firmly on the nail, the lines temporarily fade as the nail bed blanches. When you release the pressure, they reappear. This behavior, visible but not palpable, fading under pressure, is the hallmark of Muir's lines and what sets them apart from other horizontal nail changes. These lines reflect a specific and measurable problem in the blood. They appear when albumin, the main protein circulating in the bloodstream, drops below approximately 2.2 grams per deciliter. This level of hypoalbuminemia is not a vague or nonspecific finding. It indicates that the body is either losing protein faster than it can replace it, or that protein production has been severely disrupted. In kidney disease, the most common cause is nephrotic syndrome, a condition in which damaged kidney filters begin leaking protein into the urine at high rates. When albumin falls to this level, localized fluid accumulates in the nail bed tissue, which compresses the tiny blood vessels there and creates the white banding visible through the nail. This was first described in a landmark 1956 paper published in the British Medical Journal, in which the original researcher examined 32 patients with the lines and found that 23 had nephrotic syndrome and the remaining 9 had hypoalbuminemia from other causes. Critically, when albumin levels were restored through treatment in 4 of those patients, the lines disappeared entirely. They are not a permanent structural change. They are a direct reflection of what is happening in the blood right now. A person came in at 68. They were active, not overweight, and felt generally well. During a visit they mentioned almost as an aside that they had noticed some faint horizontal lines on their nails over the past several months and had assumed it was probably nothing. Careful examination confirmed Muir's lines across several fingers. A full workup revealed nephrotic syndrome with significant protein spilling into the urine. The protein loss had been occurring for months. Their body had been quietly asking for attention. Type the word protein in the comments if you want to receive the full breakdown of how kidney protein loss shows up across the body, not just in the nails. It will be sent to you directly. Sign 4, Bow's lines. The fourth sign tells a different story from the others. Where most nail signs build gradually and reflect chronic ongoing conditions, Bow's lines appear in direct response to a specific event. Bow's lines are horizontal grooves or depressions running across the nail plate. They appear because when the body undergoes a significant physiological shock, an acute kidney injury, severe infection, major surgery, or any serious systemic crisis, the nail matrix briefly pauses its production of new nail tissue. When growth resumes, that pause leaves a groove behind. Over time the groove grows out toward the tip of the nail, and its position along the nail can actually help estimate when the event occurred. Fingernails grow approximately 3 mm per month on average. A groove sitting roughly halfway down the nail suggests the disruption occurred around 5 to 6 months ago. What makes Bow's lines particularly important in the kidney context is that acute kidney injury can be entirely silent. It can occur during a severe infection, extreme dehydration, an episode of very low blood pressure, or as a reaction to certain medications, and many people never realize it happened. Studies have shown that unrecognized or inadequately treated acute kidney injury significantly increases the long-term risk of developing chronic kidney disease. The Bow's line left behind in the nail is sometimes the only visible record that the event occurred at all. A study examining nail findings in patients with chronic renal failure found Bow's lines in approximately 35% of the patients studied, making them one of the more common nail signs associated with kidney disease across its range of severity. A person came in for something entirely unrelated. A clear horizontal groove was visible running across nearly all of their fingernails. After reflection they recalled being seriously unwell about 5 months earlier, severe fatigue, significantly reduced urination, and unusual weakness, which they had attributed to a bad flu. Testing revealed their kidneys had experienced a significant acute injury during that illness. Their Bow's lines told a story their symptoms had never clearly told. Monitoring and early intervention at that point prevented the acute injury from progressing silently into chronic disease. If you or someone you know has had a serious illness in the past year and has not had their kidney function checked since, type the word check in the comments. This channel will send you a guide on exactly which tests to ask for and what the numbers mean. Sign 5, Absent or Fading Lunula. The small whitish crescent at the base of each nail is called the lunula. Most people think of it as simply a cosmetic feature of the nail. It is actually the visible portion of your nail matrix, the active zone where new nail cells are continuously being formed. In a healthy person with good circulation and normal blood counts, the lunula is visible, usually white to pale, and clearly defined. When kidney disease progresses, one of its most consistent and early consequences is anemia. The kidneys produce a hormone called erythropoietin, which signals the bone marrow to manufacture red blood cells. As kidney function declines, erythropoietin production drops and red blood cell production falls with it, producing what is known as renal anemia. Reduced red blood cells means less hemoglobin moving through the nail bed capillaries, which translates directly into reduced visibility of the lunula. It appears to shrink, fade, or disappear entirely. Research has found that absent lunula is one of the 2 most frequently diagnosed nail disorders in chronic kidney disease, alongside Lindsay's nails. A study published in the International Journal of Dermatology and Venereology examining patients with end-stage renal disease found that absent lunula was present in 56% of patients, making it the single most common nail finding in that population. A separate case series published in Clinical Case Reports concluded that absent lunula should prompt clinicians to consider underlying kidney disease even in patients who have no other obvious symptoms of kidney impairment. The connection is not just statistical. It reflects a direct biological pathway. Failing kidneys, reduced erythropoietin, fewer red blood cells, fading lunula. Each step follows from the one before it. A person was noticed by a family member to have lunulae that had almost entirely disappeared across most of their fingernails. They had not noticed the change themselves because it had happened so gradually. They had been looking at the same nails every day and had simply adjusted to a new normal without registering that anything had shifted. A complete blood count and kidney function panel revealed significant renal anemia and chronic kidney disease. Both were caught and treated before anything serious developed. The fading lunula had been the first visible signal. If you looked at your nails just now and your lunula has been shrinking or seems smaller than you remember, type the word lunula in the comments. A full guide on what to track and what to tell your doctor will be sent directly to you. Sign 6. Splinter hemorrhages. The sixth sign requires you to look not at the surface of the nail but beneath it. These are called splinter hemorrhages, and they look exactly as the name suggests. Tiny dark lines, like splinters, running vertically beneath the nail. They are thin streaks of blood trapped in the capillaries of the nail bed. A single splinter hemorrhage on one nail after physical work or minor trauma is nothing to be concerned about. Multiple unexplained splinter hemorrhages appearing across several nails without any trauma is an entirely different matter. In the context of kidney disease, splinter hemorrhages appear because damaged kidneys allow uremic toxins to accumulate in the blood, and these toxins affect platelet function and the integrity of small blood vessels throughout the body. Studies on patients with chronic renal failure have found splinter hemorrhages in approximately 40 to 58% of patients, making them one of the most prevalent nail findings in kidney disease. Beyond uremia, unexplained splinter hemorrhages also carry an important separate warning. They are a classic clinical marker of infective endocarditis, an infection of the heart's inner lining that occurs when bacteria enter the bloodstream and attach to damaged heart tissue. People with kidney disease on dialysis have vascular access points that increase their risk of bloodstream infections, which means infective endocarditis is a significantly elevated risk in that population. Multiple unexplained splinter hemorrhages across several fingers always warrant investigation. A person noticed dark vertical lines beneath several of their nails and mentioned them during an appointment focused on something else, almost as an afterthought. Investigation revealed active kidney disease with abnormal platelet function from uremic toxin accumulation. They later told the team they had almost not mentioned the nail finding at all because they had assumed it was nothing. That almost omitted detail changed the course of their evaluation. Type the word signs in the comments if you want to receive the complete kidney warning sign checklist that you can print and bring to your next appointment. It will be sent to you directly. The capillary refill test. Do this right now. This is a test you can perform on yourself immediately using nothing but your hands. It is called the capillary refill test and it directly measures how quickly your smallest blood vessels recover from pressure. Hold your hand at the level of your heart. Use the thumb of your opposite hand to press firmly on one of your fingernails for approximately 2 seconds. You will see the nail bed go pale as blood is pushed out. Then release the pressure and begin counting quietly. In a healthy adult with good circulation, the pink color returns to the nail bed in under 2 seconds. If it takes 3 seconds or longer, and you get the same slow result on 3 or 4 different fingers, that is a meaningful sign that your microvascular circulation is impaired. In kidney disease, a slow capillary refill time can reflect renal anemia reducing the oxygen carrying capacity of the blood, fluid retention affecting peripheral circulation, and cardiovascular changes that develop as a secondary consequence of long-standing kidney dysfunction. Clinical guidelines list impaired capillary refill as a practical bedside marker of systemic circulatory compromise. Do this test right now before you finish watching. Do it in a warm room with warm hands. Cold temperature constricts the peripheral blood vessels and distorts the result. A person tried this test one evening after watching a video about circulation. They counted nearly 5 seconds before the color returned to their index finger. They tested their thumb, then their middle finger, then the fingers on their other hand. The same slow result every time. A phone call to their doctor led to a full workup that revealed significant renal anemia from undiagnosed chronic kidney disease that had been progressing silently for over 2 years. That phone call made early intervention possible. Your practical framework. Starting today, take both hands to a window in good natural daylight. Look at each nail one at a time and work through the following checklist. Look for a sharp two-tone division, pale near the cuticle and brownish near the tip. That is Lindsay's nails. Look at the full nail surface for a frosted white appearance with a colored strip at the very tip. That is Terry's nails. Look for horizontal white bands running across the nail that you can see but cannot feel, bands that fade when you press the nail. Those are Muir's lines. Check for any deep horizontal grooves across the nail plate. Those are Bow's lines. Look for tiny dark vertical lines beneath the nail's surface that appeared without any trauma or injury. Those are splinter hemorrhages. Examine the base of each nail for the lunula and notice whether it is present, shrinking, or has disappeared. Then perform the capillary refill test on at least 3 fingers and count the seconds honestly. Write down what you find. This step matters more than most people realize. These changes are slow and gradual, and human memory is unreliable across months. Take a photograph of your hands in natural light today. That image gives you something concrete and honest to compare against 6 months from now. If you observe one of these signs, mention it at your next routine appointment. If you observe 2 or more signs together, do not wait for your next annual checkup. Call your doctor's office this week, describe what you observed, and ask whether you should be evaluated sooner. Before closing, if what has been shared here has given you something you did not have before, please subscribe and share this video with someone you care about. A parent, a sibling, a friend over 60 who is not paying close attention to their health. You do not know whose life this information might change. Share it now, not later. One final thing. Do not use any of this to diagnose yourself. What these signs do is give you a specific, informed reason to have a conversation with your doctor. The full clinical picture, your history, your medications, your other symptoms, is what produces an accurate diagnosis. Your job is not to diagnose. Your job is to notice, to document, and to speak up. That is the part most people never do. And it is the part that makes all the difference. Your nails have been sitting at the end of your fingers your entire life. They have been taking notes every single day about how your blood is moving, how your kidneys are filtering, and what your smallest blood vessels are doing. The only thing that was missing was someone telling you how to read what they have been recording. You now have that. Use it.